Bumps, bruises, illness, and accidents are part of growing up. When your child needs urgent medical care, there's only one area emergency department that offers specialized pediatric care, 24 hours a day, 7 days a week. The University of Michigan Children's Emergency Services.
In Children's Emergency Services, we have made a conscious choice to focus our careers on caring for sick and injured children and have a very special relationship with both the unit and the patients we care for. So start rehydration at home slowly, 1 to 2 teaspoons every 5 to 10 minutes. Everyone here is a specialist in children's care. We have advanced training in children's emergency medicine. Each and every one of the faculty has to achieve that training or they're not able to work in our area.
At Children's Emergency Services, your child will benefit from all of the advanced medicine and expertise of one of the best hospitals in the country.
Because we are the University of Michigan, we have basically every specialty that you can think of represented. If you have a simple problem, we can solve it quickly and efficiently and get you out the door happier than when you came in. If you have a more complex problem that we uncover during the course of your care, you wouldn't need to be transferred. We have the resources here to take care of anything.
Although many facilities do not offer advanced pain management, in some cases requiring your child to be transferred to another emergency department, Children's Emergency Services at the University of Michigan has physicians trained to manage pain in children.
We've all been trained in analgesia, sedation, anesthesia. We really are able to provide an optimum level of pain control or sedation for your child should they have to undergo a painful procedure.
Hey, you want to help us? You hold on to that part. There you go. People will present with something that they think is mild or minor. And yeah, we do a great job taking care of that. But frequently people will come in and they come in with a fever or something they think is pretty benign. And then it ends up being something, unfortunately, not benign. So if your child needs to go to an MRI, 24/7, we can send them to the MRI. If they need to get CT, they can go 24/7 to CT. We can reset bones, they can go to surgery. All that stuff is right here at your fingertips, so you don't have to leave, which I think is really important, especially in a crisis.
If you can get the child to tolerate tiny amounts of H2O, sodium chloride, and glucose. We also teach the next generation of pediatric emergency specialists. So we always have to keep up on the latest trends, the latest treatment options, and the latest literature.
The Michigan difference in Children's Emergency Services starts the minute you drop your car off to our free valet parking and enter the triage area. There you are immediately greeted and sent directly to the Pediatric Emergency Department, a separate child-friendly unit adjacent to the General Emergency Department.
My name's Diane. I'll be taking care of you today. Okay, you and your mom.
We don't like to keep people in the waiting room for very long. If there's an open room, we'll assign you to that room immediately so that our pediatric nurse can do a little more thorough job of assessing what your needs are, and then a physician will see you as soon as possible.
Parents and family members are encouraged to be with their child. This helps to soothe the child and to keep parents fully informed. The calming and comfortable surroundings in Children's Emergency Services help families to manage the stress of a child's illness or injury.
When a child comes to any healthcare facility, whether it's their own doctor or the emergency department, it's scary and frightening, and we try to really bring that level of scariness down by approaching the child in a friendly, calm way.
I think that looks okay, but that looks a little wide.
Once your child's been treated and is deemed ready for release from the hospital, we go over a careful discharge plan with you, and that if you ever needed us again in the next 24 hours because your child became more ill, we're here. We also are very sensitive to the fact that you may have a private physician that you work with, and if we need to involve that private physician in the plan of care, we will do that right away.
Okay, thank you very much. Yeah.
As a mother, I would definitely bring my child here.
Bye-bye, thank you.
Parents can count on getting the absolutely best care here in the emergency room. Parents want you to care about that child as much as they do. They expect excellence, so that's how we look at it. Your child is number one for you, it's also number one for us.
We do so much for our children in every other aspect of their life. Why would you skimp on their care during a crisis? If they had an illness, whether minor or major, wouldn't you want the best care?